So we were just talking a little bit about sustained talk, which most people call denial.
Well, I'm glad I don't have any of that.
You're a lucky man.
Thank you.
So, it also, anyway, it's when people are just saying, this is why I don't want to change. I'm happy the way that I am. It's, God made it, that marijuana stuff, things like that.
Yeah.
So,
Okay.
So you were gonna play with me a little bit, and
yeah.
and you're gonna.
Well, you were asking me why I don't like to take my medicine.
Right. So you're a patient who's been diagnosed with some maybe schizophrenia, bipolar.
I'd like to call it mild schizophrenia.
Okay, mild schizophrenia is fine. Good. Okay. Just a touch.
Yeah, just a little schizophrenia. But I'm okay with it, and so am I.
Okay. and if you wanted to, maybe even a little drinking and weed in there, because it's also very common.
Yeah, it makes me feel relaxed.
Yeah.
I need that.
Yeah. Okay.
I got to be relaxed. If you had to ride around on the back of a garbage truck all day like I do.
Yeah.
It's stressful. But the doctor, the other doctor put me on this medicine, and I got to take it every day, and I don't like it. I'll just be honest with you. I don't like it. It doesn't. I don't like the way it makes you feel. I don't like the way it makes me act, and it's taken my sex drive and just thrown it in the back of the garbage truck.
Well, that is a bummer. I mean,
it is.
So you said the first one, you said you don't like the way it makes you feel.
Right.
So tell me a little bit about what you don't like about what you've noticed about it.
Well, it's kind of like I'm in kind of a dreamy world. It kind of, I don't know, it just seems like I'm kind of like living in the middle of a cotton ball or something like that, where just things are kind of soft, and I don't know, the spice of life doesn't seem to be there. It seems like everything's bland and nothing really, food doesn't taste the same, and things don't smell right, and
very dull.
Very dull.
Very dull.
Very dull.
Yeah.
That's a good way to sum that up. And it's, well, you understand. It's just not good.
Yeah. So, and then you said you don't like how it makes you act. And if you could tell me a little bit about that.
I feel like it's taken part of my personality and just thrown it away. I don't really feel like I'm all there. I like to be spontaneous and funny and all that, and I don't, by the time I come up with a funny remark to a situation, everybody's left the room, and stuff like that, and
it's really, your timing is now.
Absolutely.
So you feel
as you can
slower.
tell, I didn't take my medication today. I'm really on my game today.
So it's you're not thinking as quickly and responding as quickly and things like that. So
it really takes the edge off, for sure.
Yeah.
Well, you understand that.
Yeah.
You can understand why I don't take it.
It sounds terrible, actually. Yeah. So that really, and then to top it all off, literally, I mean, no sex drive.
Right.
And your wife, what does she had to say about that?
Well, she wants to know who I am and what did I do with her husband.
Yeah. Where's Scott? Where did Scott go? That feisty, spirited guy. Where'd he go?
Yeah.
With the libido out the door.
Yeah.
Right.
And so she when I first went on the medicine, she thought I was maybe messing around with somebody else, because I just wasn't interested in it at all.
Oh. Okay.
I canceled my subscription to the Spice Channel.
I didn't even know they had a Spice Channel.
I don't know if they still have it or not.
So before you started taking the medication, though, when she was, even though now she's like, where is my old Scott and stuff, were there any times when she wanted you to go on the medication? And if so, what prompted those?
Well, if I stay off the medication too long, some people might say there's a problem with that,
In what way?
Well, I guess running around the neighborhood with no clothes on isn't really good.
Okay.
I thought I had...
Might get you into trouble legally.
Yeah, well, I thought I had my gym shorts on, but they said that I didn't.
Okay. What else?
Well, I end up in the hospital.
And what do you think about the hospital?
Don't like the hospital.
No.
Not sure that the hospital is worse than the cotton ball, but I don't like it either.
So you'd really like to stay out of that hospital?
Well, I got a question for you. You're a doctor. Why don't you guys come up with something else besides either being in the hospital or taking this stuff every day? Can't you come up with something? I mean, you guys, we put a man on the moon 50 years ago. I mean, and you're still got to give me this stuff that makes me feel like a zombie that hasn't had a drink of water in 4 days. It just doesn't seem right. You guys ought to come up with something better. That's what I think.
I agree with you. I really do. So, and I think that a lot of times the medications, they do have a lot of side effects, and I completely understand why people don't want to take them.
Yeah.
Yet at the same time, I know running around and getting in trouble for being naked or having to go to the hospital, not such a good thing either. I'm wondering if I could run some ideas by you that some other patients of mine have tried.
I suppose.
Okay, thanks. We could, if you're, because as you can tell, this is really more of an art than a science. Try some other medications and see how you do on them, and perhaps you won't have these side effects. And it really is just a matter of kind of experimenting around to get to see if we can get to a point that at least you're not having these really bad things happen of getting into the hospital and getting arrested and stuff, versus feeling more like that spirited Scott that, watches Spice Channel, I mean, because I can tell Spirited Scott is a hoot.
Well, yeah, I'd like to. Well, I don't know. Can you drink with them? Some of these other ones?
Well, Scott, it would tell me a little bit, since you brought that up. You obviously drink, and tell me a little bit about your...
Well, I don't really drink like people, like some alcoholic or something, but I do. I like to take the edge off, with a few drinks, that not a lot, and really.
How often do you do that?
Not every day.
Maybe every other day?
Maybe.
Okay.
Maybe not. It's not all the time. It's not a problem.
Okay.
Certainly not a problem.
How would you know if it was a problem?
Well, if I was like getting arrested for drunk driving.
So if you got a DUI, you would really know.
Well, that's what alcoholics do. I'm not an alcoholic.
Okay.
I'm just, I just like to have a few drinks. I mean, obviously I have this diagnosed condition, and I think, if I were able to, maybe take a few hits off of a joint and have a couple of beers, I think that's about the same as taking the medicine.
Well, you know what? There are a lot of people that wouldn't disagree with you on that exactly. But I know that they're never quite sure how they're all interacting all together. Like the weed kind of tends to make people a little paranoid anyway.
Yeah, I got to be careful with it. If I take more than a hit or two of it, it can be a bit of a problem.
Yeah. What happens if you take a little too much of it?
I get edgy.
Yeah.
I get edgy.
Yeah. And you don't like that?
No. I'd like to just be normal. Is what I'd like to just be normal, where I don't have to take medicine, and I don't end up in the hospital 3 times a year, and I don't find myself in the neighbor's yard
running around naked
with the statue.
Okay.
They were really ticked about that
That's
statue
right.
thing this time, and I don't know why I keep going back over there, but
You must like that statue.
I really don't. But apparently, when I'm in that state, something about it. I'm not sure.
So it's, if we could maybe find a medication that didn't give you as bad side effects, perhaps you might not have to drink as much or at all, or smoke a little weed to take the edge off. I mean, who knows?
Yeah, maybe.
what happens,
I guess that's possible.
Yeah.